It is Tuesday, June 16th. And welcome to our daily task force update. Today being a bit of a special day because we're opening this one up to the community for questions. We also have members of our media here, and members of the task force are joining us today. Lloyd Phillips, who is the Commissioner of Public Safety, is with us. Lisa Westaway from the Zacharie Memorial Hospital Center. Dwayne Zacharie is the Chief Peacekeeper, and from the Mohawk Council of Kahnawake is Ratsénhaienhs Frankie McComber. Today should be interesting. A lot of questions have already come in. We will allow more questions as we go along. And we do have, like I said, some of the local media will be here. Speaking of the local media, we've asked Paul Grafe, the news director of K1037, to be the moderator for today's program. So I'd like to welcome him right now. Paul?
Joe. Welcome, everybody. Nice to be here today. A little bit different than sitting down in the radio studio and people listening and watching at home on Facebook Live, but glad to be here. Also joined by media members, Marisela, Amador from the Eastern Door, and Riwase publisher and editor Greg Horn with us. So a lot of questions have already come in about a lot of the emergency plans coming up from the COVID-19 task force over the last several days, considering as well that the emergency state of emergency has been extended in Kahnawake till July the 21st, as well that the task force is aiming for June 22nd to open up beauty salons and similar businesses in the community. But over the last 24 hours or so, a lot of questions have come in from community members, so I want to get to those right away. The first one is for the Commissioner of Public Safety, Lloyd Phillips. Lloyd, this one came in and says, I usually conduct moon ceremonies on each full moon. I haven't gathered the women who usually participate. Can I conduct one on the next full moon, which is either July 5th or 6th, outside a small ceremony, of course, sitting around a fire limited to about 8 people?
Okay, the answer to that question is yes, you can. That's we fall in the category of a gathering outside. If there's 8 people, obviously in safe distances apart, there should be no problem with you conducting that ceremony, and certainly encourage that for the spiritual well-being of everybody.
Okay, thank you, Lloyd. Next question is going to be for Chief Frank McComber from the Mohawk Council. I'm wondering if the social clubs and anywhere else that smoking is still permitted in Kahnawake, will they reconsider not allowing smoking because they've obviously been closed and they remain closed at this point. The reason this person is asking, they say, is because a lot of people have quit during the pandemic and because of fears associated with the virus attacking the lungs. Frank.
We are certainly going to have to take that into consideration moving forward. I have not even thought of that at this time, so we're going to be looking into that, and we'll get back to you with a good answer.
Okay, thank you very much for that one. What about recommendations? Lisa, this one's for you. Comments on children, family members, not within the same household, not under the same roof, as the task force has been saying for 3 months now, swimming together in backyard pools. Does distancing still have to be enforced in that case? And also children from around the neighborhood, like neighbors and such.
So that goes with a question that we've spoken about in the past. Yes, you can swim in your pool. You can be up to 8 people outside. However, you should still respect the physical distancing. So we've said that that is the cornerstone of success in moving forward and ensuring that we don't transmit the virus. So please keep the distances, maybe have all the people from the same household in the pool at a time. But yes, you can swim together.
Okay, also what is being done for residents at the Elders Lodge? Because it appears that there have been a lot of elders who have been able to go out on the bike path in that area and visit at a distance with family members, at least according to this community member who sent in the question. Will that be permitted? Will everybody be made aware of it? And what is the plan? Because I know that it had come out a little while ago that there was going to be visiting at the Elders Lodge, and then that quickly was closed down.
Yeah, Derek Montour is the ED of KSCS, and he and I met with the elders not that long ago, a couple of weeks ago, and they expressed some of their needs and wants. And so I know that KSCS is working on those as we speak. So they're working, so firstly, walks have been permitted for a long time. So residents have been walking out on the path, often accompanied. Some of the other plans they're looking at are visitation, and they hope to have a plan in place by the end of June. Residents are now eating in the dining room, so they're started a pilot project this week, and it will be increasing over time. So right now it's just at lunch, but I believe they're going to be looking at other meals as well. And they're also looking at a plan for ordering food in to the Elders Lodge. So there are many plans that are in the process of being implemented or developed, and Dr. Gauthier is involved in providing medical support to ensure that all the risks are mitigated for all of these plans.
Thank you, Lisa. The next question is going to go both to Lloyd and to Peacekeeper Chief Dwayne. Zacharie, Lloyd, we'll start with you. Can there be more signage for non-natives, and specifically in entering the island portion of the community, because there have been a lot of people that have been going to that area these days, and seems that they're gathering, and there's also been some arguments between locals and non-locals asking them to leave first politely and then not so much.
Yeah, I mean, obviously there is a gap, I would assume, if people are not seeing the signs that are there, especially the non-locals. But if you go over the bridge onto the island, there is actually a sign right there as you go. Actually, there's two signs there when you cross over the bridge. So no, there really should be no reason why non-locals should not be able to recognize the fact that there is signage there. It's in both French and English, in case you're not from the community. And you know, there are some along the bike paths, you know, on the other side of the island. So obviously, if there's a need for more signage, if it's not adequate according to you know, the peacekeepers, we can always repurpose signs from other areas or have additional signage put up, and that's not a major problem.
Dwayne, what about stepping up patrols on the island for people who shouldn't be there?
Yeah, just to add to some of the comments that Lloyd had, I think what we do all the time is we evaluate. We're always looking for a way to improve the service that we provide to the community. We work pretty closely with public safety, the coordinator of public safety, to evaluate where the best sign placement would be. I think we can go back and have a look if people are complaining and find that we have lots of non-locals in a particular area that they shouldn't be. By all means, make sure you call the Kahnawake Peacekeepers, so that way we can intervene and we can deal with the issue. Adding extra patrols is something that we would definitely evaluate and look at. Over the last few weeks, or since June 1st, when Kahnawake opened back up for retail, we have increased the number of patrols, the number of officers on shift, and that's always something that we're evaluating on a day-to-day basis. So going forward, we'll continue to do that. And remember, always, it's important for feedback, right? Let us know if there are issues or problems that you see out there, and we'll look at it and see if there's improvements to be made.
Now, for that, Dwayne, now because we did say that the Eastern Door and riwase are joining us via Zoom at this point, I want to turn it over to them for just a little bit, and then we'll get back to more community questions. Let's go first to Greg Horn, the editor and the publisher of riwase. Greg, do you have a question?
Yeah, I think one of the things that a lot of people are asking about and talking about, and this is probably good for you know, Lisa and Lloyd, is what's the number of active cases that we have right now in the community? I know Monterey Public Health has put out numbers. I think there's 23 positive cases throughout the pandemic, but how many of those are currently active?
How many active cases?
Okay, I'll repeat that because it's hard to hear in the room off of one computer via Zoom. For everybody is social distance in the room, if you've seen on the wide shot on the camera. So, Lisa, the question was, what are the numbers of active cases in the community? Because what Greg's seen on the map is either 22 or 23 cases overall that have occurred in Kahnawake of COVID-19.
Yeah, so there are 23 cases overall since early March. However, there are only 2 active cases right now until the next week, actually. So 2 active cases in Kahnawake.
Okay, Greg has had a question. We'll go back to him a little bit later on, but now we'll also want to hear from Marisela Amador from the Eastern Door. Marisela?
Yes, hi. Thank you for having me. My question is regarding the announcement about the extension of the emergency, the state of emergency. Now, I know that it needs to be extended every 30 days. What's the justification for continuing extending it, and how long do you guys foresee this extension to continue? How long will we remain in a state of emergency?
Well, according to the Kahnawake Emergency Preparedness Law, there is a maximum of 30-day periods that you could have a state of emergency. Obviously, we have extended that on 2 occasions, and that was done again recently this past Monday by consensus by the MCK, the Chief and Council. And the reason why it's extended at this point in time is because, as we know, we are obviously still within the pandemic mode. Although things have somewhat settled down, the numbers are going in the right direction. Things are starting to improve around us. Things are gradually opening up, but we are still not into phase 2 of the Kahnawake reopening plan. There are still measures that need to be put into place to ensure the safety and security of our community. So in order for us to do that, it was necessary to have the extension of the state of emergency until July 21st. And throughout that time, we're always evaluating. Will there be a need for another extension? That only time will tell. We'll see where we are in a few weeks in terms of where stage of opening we are in the community, what's happening around the province, in Montreal area and such. So we have all these factors to really look at, and then we'll decide at that point, if there's a need to suggest or request an extension to the state of emergency. But to coincide with that, there's also planning happening on a day-to-day basis on how do we transition out of a state of emergency into a way of monitoring and maintaining some level of measures in place, some level of safety mechanisms that will ensure public safety, after the state of emergency is over. So there's 2 parallel streams working side by side, and again, it's all in the name of public safety. And as well, we always have to have a monitoring function to see what's happening around the world, as things progress, especially when we're looking towards the fall.
Thank you, Lloyd. Of course, we have a lot of questions that have come in from the community at questions@mck.ca, and one of them being a community member has stated that in Calgary they are allowing family to visit elders in nursing homes with social distancing. Why can't family be protected just like the nurses are in order to visit their family? Lisa, I think this one's for you.
So the nurses at KMHC actually are, right now they're extremely cautious. So they are going to work, they're going home, they have extreme measures that they need to put in place in order to ensure that they don't bring the virus into the hospital. And not to say that community members are not able to do that, and we're looking at how we can implement visitation in the future. And you should be getting a call, as I mentioned this past week, because we're going to start visitation outdoors. Coming into the hospital, we're not quite ready for that yet. So we have, you'll be receiving a letter from KMHC in the next week where we're going to be having a meeting so that we can get a better understanding of what families want. Right now we have very mixed feelings about opening up the hospital, and some people want us to have very strict measures, others want to loosen up. There's again a balance that needs to be looked at with this, and a lot of ethics about quality of life versus the health and safety or the possibility of death. And we have to look at these, all of these scenarios very closely, very seriously. We have to hear what families want. We have to speak to residents and understand what they want, and all of that is going to be happening in the coming weeks. Of course, until we finish the second health check, we're not ready. We are not in a position to make that decision. In fact, I don't feel ready to make that decision for the hospital, nor for the residents. And once we have completed the health check, we've started having meetings with families and we have a better understanding of where we're going, then we'll be able to look at the possibilities of opening up. In fact, I participated in a conference today that really looked at all of the ethics and the questions about allowing visitors into residents across the world. And there were speakers from New Zealand, from Australia, from all over, and weighing in, and it's really not an easy question to answer. So we really need to get a lot of feedback from community, from residents, before we make that decision moving forward, and you'll be consulted for that.
Well, as a follow-up to that one, Lisa, in New Zealand they had no cases for 24 days. 2 visitors came in to say their goodbyes to their mother who was in her final days, and they brought the virus back into New Zealand, a country of 5 million. So I guess there are some numbers in there for you guys to consider as well. There are a lot of questions, Lisa, that are going to go to you. By the way, folks, you're of course watching a very special edition of Kahnawake 911 Live on Facebook, as we are joined by 4 members of the COVID-19 task force in the community who are here to answer your questions today, many of which have already been sent in and are still coming in. Should non-residents working in the community be tested as well? And if so, do they have to do it here in Kahnawake at the KMHC site or at other clinics outside of K-Town?
So right now, if you're a non-resident working in the community, you're able to come and be tested at the KMHC testing site. So if you have symptoms, we urge you to contact the hospital and to make an appointment. If you are also a non-resident who's working in essential services at KMHC or at KSCS in specific services, we're presently testing those who are asymptomatic. So it's a small group, but I'm not sure where this question comes from or where you work. But if you're in one of those categories, then yes, you can be tested. But if you have any question about that, I urge you to contact the testing site and they'll be able to provide you with an appointment if required.
Another one came in from a community member who works outside of the community in a hospital in Montreal, a non-COVID hospital, who says that their partner is also is also an essential services worker, and being that she is already isolating herself from her family and the community, she was asking if her partner can come into her house, and as they have the restrictions put a great strain on them, on her life, and is therefore her mental health as well. And you know, what are your feelings there? Because they haven't even been going to any businesses in the community and would continue to abide by that.
Well,
I understand in that situation, it's very unique, and over the months, you know, we have obviously put together a number of measures and a number of directives that, you know, that blanket, you know, the masses. But we find out there's so many small details that each family or each situation is slightly different. Each business is slightly different than the next business, and to try to get something that blankets everything is very difficult. But in this particular case, the general rules still apply. If you don't live in the same household, you know, you should not be, you know, mixing households, and you shouldn't be going into other people's homes. You can visit at a safe distance, but that's the general rule, and in this case, that rule would still apply.
Well, thank you for that, Lloyd. Getting back to the online health check, Lisa, one question came in for the KMHC. When the KMHC calls them, if there are 2 people living in the house, do we both complete the phone call? She said the first time that she did it for herself, but did not speak for her partner. So, you know, is there a way maybe that the people calling them could make sure that it's for everybody in the house?
Yeah, actually it should have been, so that may have been an error on their part, because there actually is a question about how many people live in your household. And in fact, we reached 900 households, but we did the health check on over 1,200 people. So it's because of multiple individuals living in the same home. So I'm sorry, I don't know what happened there, but definitely you should speak for your whole household. And anyone who completes the online health check will receive a call from the testing site so that we can go over your answers with you.
Okay, another one has come in. My 94-year-old grandmother lives alone in an apartment in NDG. I've been doing her groceries since March, and now that the warmer weather is here, and no kidding, we have about 5 straight days of 30 degrees coming up, I'd like to have her in Kahnawake for the summer. We're 4 adults living in the house, 3 currently working outside of the home. She wouldn't have her own room, though. Is it recommended yet to bring her back, or better to leave her in her apartment in NDG? I've been worried about her being so isolated.
So we still have the same recommendations in place. We feel that those who are most vulnerable, over 60, immunosuppressed, should be isolated from others. So if we take my parents, for example, who are in their 70s, they're not coming into my home, and that's for their protection. So it's not something that we would recommend. Of course, somebody who's 94 living alone, we would want you to check in on them and make sure that they're doing okay, and to find ways to ensure that they're safe. But we wouldn't recommend that they come into your home, especially under the conditions that you mentioned, because there could be transmission. So it wouldn't be something that we'd recommend at this point.
Thank you very much for that, Lisa. We want to go back to the journalists who are joining us via Zoom from the Eastern Door. Marisela, Amador. Marisela, you have another question. Marisela, can you hear us? Oh, I think we've lost sound from Marisela. I'm going to get to the next question here. Are yard sales permitted in the community? That one has just come in the last little while via the Facebook Kahnawake 911 page. Lloyd?
Well, at this point, no. It's an interesting question, because that's something I think we should have a good discussion with the task force members to look at all the factors that go into having a yard sale. But generally, they're outside, and if there's social distancing rules in effect, it could be something that could be looked at and much more closely. But at this point, no. The short answer would be no. But that's definitely something I would love to table with the task force for a full round of discussion and get some feedback from Dr. Gauthier and others.
Okay, thank you. We've also gotten questions about border crossings and people who are going to the United States and coming back and not self-isolating. What is the task force doing about this? I certainly know that the recommendation has been there, or the directive has been there, and it's a Canada-wide directive that is also being adhered to, or it's supposed to be adhered to in Kahnawake. What do you do about people who are not coming back and quarantining for 14 days?
So I think that's a question that I could possibly answer. I've taken a number of calls over the last few weeks, or actually at this time, last few months, about people who are doing cross-border travel. Right now, the Quarantine Act is in effect. Essentially what it says is anyone who goes into the United States and then returns back home must quarantine, which means self-isolate. You're supposed to do it for 14 days. That means staying home, staying in your house, right? Staying away from other people, making sure that you're social distancing, that you're doing all of the hygiene protocols. I know that lots of people asked a number of different questions about it. So what could happen, and there's a number of, issues that surround it. So every time you cross the border, you're taking a chance. When you cross the border, they take your information, and there's a chance that you would be contacted. And if you're contacted, they're hoping that you're going to be at home self-isolating. If you're not, they have the option of then pursuing certain remedies. And some of the remedies are, you can be fined, you could be charged with a criminal offense. I don't know how far the authorities who are responsible for enforcing it would go. I know there have been times when other police services have contacted us in regards to the Quarantine Act and asked us if we could check up on people from the community. We've done that. We had our check. All of the people that we've been asked to look into, they were all home and they were doing the self-isolation thing. They were following the rules. I'm hoping that as things go along, people are going to be responsible. Everybody who travels has a responsibility. Everybody who comes into the community has a responsibility. Every single individual has a responsibility to follow all of these rules so that they make sure that everyone else is safe, right? It's not just up to the task force or the peacekeepers or the fire department or any of the first responders or frontline workers at the hospital. It's each individual in our community, and that's why I think Kahnawake has done so well.
Yeah, Dwayne, we got a comment sent in for the task force, and I'll read it to you verbatim. Thanks to the task force for doing their best to keep us safe. Some decisions, not always understood or agreed to, but overall, hats off and great job so far. We have to keep an open mind, as no one alive today has been through a pandemic, so let's all work together. One of the other questions that we've gotten based on the testing of non-locals, Lisa, is should those non-locals who are working in the cigarette stores also be tested in Kahnawake for COVID-19 if they start experiencing some symptoms?
Who are working in Kahnawake? Yes, we would definitely be open to that. So just a reminder that anybody who's working in any of the businesses that have reopened in phase 1 should be doing health checks daily, so monitoring for COVID-related symptoms every single day. And should you have COVID-related symptoms, you should be home and calling the testing site to be tested. And that includes all employees in Kahnawake. And it's really important actually, because then we need to be able to speak with everyone to be able to do contact tracing, make sure that we contain the virus as quickly as we possibly can. That's part of the importance of our strategy in the reopening process. So yes, definitely.
Niawa, Lisa, and Niawa to all of you for joining us. And of course, this edition will be up on the Facebook Live, the Facebook page for quite a while if you want to go back and check the answers to a lot of the questions that you've heard. We were fortunate enough to be joined by 4 members of the COVID-19 task force in Kahnawake, the Commissioner of Public Safety, Lloyd Phillips, Lisa Westaway, who you just saw, the Executive Director of the Zacharie Memorial Hospital Center, as well as Mohawk Council of Kahnawake Chief Frank McComber and the Chief of the Peacekeepers, Dwayne Zacharie, who was also here in the command center for the COVID-19 task force. It's been an honor to be with you today. Join us tomorrow morning on Kaahnawake's K1037, as well as we will be speaking in further depth and detail with the COVID-19 task force members. So, Niawa, for having me. I'm Paul Grafe. Good evening.
And thank you very much, Paul. Thank you all for joining us. Thanks to our local media as well. At some point, we may do this again. It does take a lot of work and planning, but I think it went very well. And we'll see you tomorrow again with our next COVID-19 Task Force Daily Update. So on behalf of the entire crew here and the COVID-19 Task Force, Niawakoa, thank you to Paul Grafe for doing a great job today. We shall see you tomorrow. Take care. Ona iwahi.